Hello everybody, I am Dr. Shashank Joshi. I am an endocrinologist, diabetologist and an internist. I am an endocrinologist attached to the Lilavati Hospital, Sir H.N. Reliance Hospital and Joshi Clinic in Mumbai. I am also the current president of the Indian Academy of Diabetes, Indian Thyroid Society, and I have led several other societies. I am the immediate past chair of the International Diabetes Federation for South Asia. So artificial intelligence has entered our lives now, whether it is through a mobile phone, whether it's through a computer screen, whether it's through a television screen, we are all now being captured by AI. And it has clearly made its entry in the healthcare delivery model space, particularly in chronic disease modeling, because we can recognize diseases earlier. We know whom to screen, how to screen, with what to screen. For example, if it is hypertension or blood pressure, we know that we need to measure blood pressure, how frequently we should measure blood pressure. Blood pressure measured at home is as important as being measured in the doctor's chamber or measuring it 24/7. So artificial intelligence is allowing us to measure, to screen, to identify, to diagnose diseases. And once we diagnose somebody with a healthcare problem, like for a simple disease like hypertension or diabetes, then we know how to move it to the next level, how to take care of that individual living with diabetes or hypertension. And in that space also, artificial intelligence has a huge way to capture small little things, because today we are in the era of precision medicine or personalized medicine. And when we are moving the handle in personalized or precision medicine, no two human beings are different and no two human beings will have the same response. Somebody will respond to a medicine, somebody will respond to a lifestyle change, somebody may not respond to a diet or an exercise or a sleep pattern. So it is important that artificial intelligence today in healthcare space has become a pattern recognizer for individualizing care, and therefore we are able to deliver the desired outcomes for a disease process in a very systematic way, in a very precise way, and in a very personalized way. So I think from an input standpoint, I think artificial intelligence is here to stay, and not only it gives us the right information, but allows us to make the corrections under medical supervision, how to improve the outcome, health outcome and happiness outcomes. Drugs or technology or both, can they really cure diseases like diabetes or hypertension? Now remember, chronic diseases like hypertension and diabetes are often called incurable. But we have taken and borrowed a term from cancer medicine called remission. So remission is possible with the appropriate nudging from artificial intelligence and technology, and ensuring that under medical supervision, down regulating drugs which particularly don't cause weight gain or low sugar attacks and have some compelling cardiorenal evidence and cause some weight loss, we are able to get the diabetes in remission or blood pressure in remission. So with the enabler as artificial intelligence, we can recognize patterns with the help of a coach, a lifestyle expert, a doctor's supervision, and make small little changes in that person living with diabetes or hypertension, so that we can keep the values under control. So I think control is possible, remission is possible, cure may not be possible. And the word remission is used because the minute you stop the lifestyle changes, then there is a likelihood of a relapse. And therefore, I think as doctors of science and medicine, we believe that we are living in an era that we are having the best of technology and best of medications which have generated some high science outcomes which can ensure that the disease can stay in remission or in control. And if we are not able to do that appropriately, then there is likelihood of a relapse. And therefore, as I said, we are in best of times, but we are in worst of times. We are in best of times because we have technology and medications available, and we are in worst of times is because adherence to them is a challenge. And therefore, and the second biggest problem we have is affordability, access to some of these technologies or medications to most common people at large. So technology can really ensure and assure safe healthcare delivery, because technology is like a supervisor. Today, in the simple chronic disease models like say diabetes or hypertension, we have technology where we have sensors which sense glucose 24/7. So we know that if you are sleeping at night and if you have eaten less, if your sugar is going to go low, there is going to be an alarm. So there is a safety valve there. So it allows the person living with diabetes to sleep better even if they have consumed insulin, and also gives you a nudge that you ate less today, consume less insulin or consume less medications. So from a safety filter, the modern technology has been a big uh, change making, decision making, behavioral support system to tell us and recognize the red flags. Because it's important that when we are delivering healthcare delivery, we need to recognize side effects, adverse events, or alarms, which are like low sugar attacks, high sugar attacks, and then connect them with a healthcare provider or a doctor for help. So I think technology is an enabler and a safety valve to ensure and assure the person living with a disease condition that they can be connected to their healthcare ecosystem so that they feel safe and secure. So I think this is a big change which has occurred. Imagine if you were living in an era where you didn't have a mobile phone, you didn't have a landline phone, and you were not connected with your doctor or a healthcare provider, how insecure you will feel. So this is what technology has brought into us.